has changed
Yeah.
a lot since we had to quarantine and stay home, so it's a little bit different than it used to be, especially Hollywood, red carpet of Hollywood. We can't continue, everything is on hold. We can't just go out and interview celebrities. So we changed the platform and we do things online. And I also, I'm helping out hospitals. I have a nonprofit organization for trauma victims. So we're trying to get all the masks and PPEs, as many as we can, that we can donate to the hospitals. There's more work online, I will say, than we used to move around, the whole day it started early in the morning, then you're stuck in the traffic for a few hours, all this is gone. You wake up in the morning, you have your coffee, you get on a computer, and we do interviews online.
Oh boy, I was booked a 25-city tour this year to go all over the country, all over the world, South America and England, and about 15 different states. And unfortunately, right away I had to cancel everything. I have a movie that I'm supposed to be filming in Boston in June, a really good movie called Deceive. So it pretty much shut down everything. Trying to be optimistic in the sense that there's millions and millions of other people who have it a lot harder than I do right now. So as much as I'm upset and disappointed, there's really no way to complain because everyone is more or less going through the same thing. All of our lives have been uplifted, and we're just right now trying to do the best we can. But at the same time, you just have to be thankful for what you have and to also appreciate and respect those who have it a lot harder than you do.
Yes, I photograph a lot of events, and of course the events have been canceled. And I also photograph red carpet events, and it looks like it's going to be some time before we can go back to having movie premieres and all kinds of events like we did before. And as photographers, we are usually very close together and at these events, so especially red carpet. So it's going to be a while, I think, before we can all go back to a normal life as a Hollywood photographer.
I think people, I think they think way more than they used to. We all do.
Yeah.
It has affected their life for sure. Communication stays the same because obviously we use cell phones and computers and everything, but the basic lifestyle, you used to go to the restaurants, it's closed.
Yeah.
You used to, just like Sherry Dieterman, I just talked to her, I just interviewed her, she's used to go to 3-4 red carpets and taking pictures of celebrities. Well, there's no events at all right now. So, it definitely has affected everyone, and especially because they have to quarantine. There's a lot of celebrities, they already have COVID, and they recovered, like a few of them recently. But Lady Gaga, she joined a World Health Organization to support all the medical stuff. So I'm pretty sure they're gonna have a big meeting and, big gathering. Or they're gonna do it online, I'm not sure.
Yes, I think when the news came out, and it came out pretty harsh, and people did panic because it was something that we haven't experienced before, and I think people really started going to the stores and preparing. We have earthquakes here, but we don't know in advance, but this has a curve, it has projections, and people got really scared, and I was surprised too that toilet paper and paper towels were kind of the first thing that kind of was
right?
that, yes. And I remember going to the store earlier and see people just buy paper towels and toilet paper.
Because we do in the documentary and we observing a lot and we are in a lot of different places, you have to take precautions. You have to protect yourself and follow the guidelines of sterile techniques to keep everything clean. Definitely educate everyone else in the meantime, because not everybody knows how to even wash their hands. But from what I see, I think there is definitely people have a hard time, but I also think there's a lot of hysteria, and there's a lot of panic. Maybe necessary to put everybody in place and create the discipline, but also unnecessary panic where you hear about things every 2 minutes, and people get so scared that they can't sleep at night. They have nightmares. You see people commit suicide because they just can't emotionally, they can't deal with it.
Yeah.
So I see a lot of different things, and I'd be more than happy to share it later with everyone when our documentary is finished. Right from the beginning, the CDC told us that this is a droplet. Then the airborne. Then it changed to droplet, and then it changed to airborne again. Well, regardless whether it's airborne or droplet issue, you're supposed to wear a mask. Then the CDC says, the World Health Organization tells us only the sick people should wear masks, which is really not a common sense, because if you want to protect yourself, you are the one who needs to wear a mask. So it feels like there was a lot of confusion from the beginning, and people, they couldn't make their own decision because they just didn't know, and then so many people got infected, and here it's 2 months later, everybody started wearing masks, so it's mandatory.
And that's a good point. It really bothers me because I take mass transit every day. I took it until about a week ago. And I remember the same you talked about, it was almost an evolution of, precautions to take. And I'm sitting on the train wondering, boy, they said, I don't have to wear a mask, and only people that are sick maybe, or asymptomatic, or thinking about it, So I took the train with 1 million other people in LA County take mass transit every day. Now it's down to 300,000, 70% drop. But that wasn't fair to us because I'm sitting on a train with 800 people in that cab, and they're breathing out. I'm not sure if
And you're the only one who has masks.
And so
you don't even wear a mask for yourself. You're wearing it for everyone else around you. It's what you're doing as a community. It's when I walk down the street and somebody's not wearing a mask, I want to give them one and say, please wear this, if not for you, for the rest of us.
But when it really happens, then you cannot necessarily go by the checklist, because the pandemic right now takes different turn. This is just like you go on a plane and you have a checklist, right? You have to check every single part of the plane. But what if something goes wrong in the middle of the flight? It's not on a checklist. So you have to handle the situation by the common sense and find a solution with the common sense. You cannot wait, like hospitals, right? We have a shortage on masks.
Yes.
but only FDA-approved masks are allowed in the hospital. So now we're getting tons of donations from different countries, from China, but they won't allow them because KN95,
That's different with.
this is the amazing mask that is being used in China. It's the same as N95 certified in the United States. They won't allow medical professional to use it in a hospital. Why? Because it doesn't says N95, even though that is the same, because it's not FDA approved. Now at this point, you have to use a common sense. Do you want to protect your personal or you don't? Because if you exposed right here to the virus and you want to wait for this mask to be approved, how many people are you contaminating, getting sick in it? So the common sense is missing.
So my supply chain, we are constantly importing from China all of the BMS battery management systems and fuses and cables and cords and everything that I need to do manufacturing here in the United States of these battery packs. We're building our own PCBs in China, and I'm importing all this product on a daily basis. So when this all occurred, since 50% of all masks are manufactured in Shenzhen, China, which is where my headquarters is located for that division, I just told them, I said, look, it hit China. We suffered through it for 2 months in China, and it's coming to the United States, and we need to prepare. Here, this is a KN95 respirator mask. That is what every first responder should be using, that or an N95. Either one, but the respirator is going to allow you to not have CO2 buildup so that you don't get lightheaded after a while for long-term work.
Wow.
We brought in 20,000 of these. I have 54,000 more on the way. These again, we'll sell them at cost, and these need to be for first responders. Those are the FDA approved goggles. And then these little guys right here, these are COVID-19 testing. Yes, this is drop of blood, 15 minutes.
Thank
You know if you have COVID. If you do, then this is step 1. This is not 100% accurate, but this is the best that we have. And then step 2 is go to a hospital. If this reads positive, go get tested at a hospital and do the FDA approved test, which costs $35 wholesale. I have no idea what it costs retail. But these cost $7. $7, and you can get a million of them within 14 days if you want them. So CE approval. These units here are CE approved. They're not FDA approved. I can send them to Europe. I can send them to Australia. I can send them all around the world. But the United States requires FDA approval, and I understand why. It's very important. It is very important for quality control. For the health of our citizens. I get it. But when you have a pandemic like this and there's a shortage on supplies, let's not get tied up in the minutia of a model number. Let's look at the specifications and say, do these two both filter out 95.4% of the particles? Great. Let's bring them in and distribute.
I have a lot of concerns about our president's performance. As you all know, we had agencies set up in the United States to anticipate a pandemic such as the coronavirus. Unfortunately, our president and his administration canceled those agencies. And from the start, it was a lackluster response, dismissive response, lack of preparation, which put the United States and people's health at risk. So when you measure a response or a performance, you can do it for anybody at our jobs. Is it exceeds expectations, meets expectations, or needs improvement? Unfortunately, his response immediately was below needs improvement. It was a failure. But as the governor of New York, Andrew Cuomo, says, this isn't a sprint, this coronavirus, it's a marathon. Right now we're kind of towards the first third of the marathon. So Trump's performance has improved. I think the people around him, he's got some great experts, Anthony Fauci, other doctors, medical professionals. So we'll see what it remains to be seen. But up to this point, I believe it's below expectations, unfortunately. And unfortunately, it's impacted the health and safety of our country and may have led to a number of the deaths that have now, for the first time in our history, surpassed Italy today. Number of deaths in the United States. So I think when this is done, we've got to hold the people accountable that caused this. unfortunately, our federal government, and I think everybody may agree with me, was not prepared. And I've done a lot of research, and I'm going to make a request when this is over, because I know we're all going to work together to get back, like Eric says. It's just incredible stories out there of neighbors, individuals, groups working together to help make this happen. But our federal government was caught flat-footed. And I did a lot of research. I'm going to make a demand after this for an investigation, because my research has determined that in the last administration, they created an office within the National Security Council called the Global Health, Security, and Biodefense Directorate, which was charged with exactly anticipating, reacting to, proactively doing something about a virus like this. And guess what? In 2019, January to October, right before the virus started in China, we actually were simulating exercises in the United States by this government group under Health and Human Services in states about a virus coming from China impacting the United States, starting in Chicago. And guess what? In 2018, this administration eliminated that agency, took all its money away, and they dismissed it when it first came out. So it's concerned me so much, because now coming down at the state level, as he said, we've had to take charge. The states have. And let's go to LA County, 10 million people. I asked that if March 4th, it's on the record, you can pull out the tape, March 4th council meeting, I asked our fire Chief Riddle, how many testing kits do you have in LA County? This is starting to hit hard. We know it's coming. We're starting to see the federal government's like, what do we do to protect my community of South Pasadenians? I said, Mike, we've only got 100 test kits from the CDC. 2 weeks later, fast forward, March 18th. I said, Chief, how many test kits now? I said, this is starting to spread. Because guess what? I got bad news. Those first 100 test kits were defective. The CDC sent us. So as of now, in LA County, we've only taken, let me see, I had to write it down because it was unbelievable. Just the number of tests that have been done. Can you imagine 10 million people in LA County? Let me get this correct number for you, because it's got to be correct. LA County, there's 8,000 cases. We've only done 40,000 tests. 10 million people. 10% of that would be a million. 1% would be 100,000. We haven't even done 1% of the people in the county. And if you're talking 15% of the people are coming back positive, so when we do 1 million people, that means 150,000 people are going to come back positive. A significant portion go into the hospital, significant portion ICU. So we're starting to ramp up the tests, not thanks to the federal government, but thanks to, you said, Governor Newsom, the governors, private industry ramping up, companies.
I think Donald Trump, I think he's amazing businessman, because he really is. But he really don't have the medical background. So I think he's confused if, I'm thinking, if I put myself into president's shoes, right? Because the president represents the government, right? And it's not an easy job. I completely get it. But at this point, this is a medical issue. This is not a business. This is not any other. This is medical, and we need strictly medical people to take charge over this and do speeches like Dr. Fauci, I believe. You need a medical people to control this.
Yeah, the only critique that I have about Trump today would be the trade war. I don't believe that it's beneficial for China or the United States. I believe it's hurting both countries equally. I don't see it as a way to the future that we want to have as a country. I would like to see cooperation, and I believe that if I am good for your family and your country, and you are good for my family, good business will always prohibit war. It will restrict war. It will restrict differences. We will find ways to unite and work together, and that's the world that I want to live in. I believe that consumers in the United States are paying the price for this trade war. I believe that businesses, global businesses such as my own, are losing millions of dollars because of this trade war. And at the end of the day, I would just love to be able to see the world thrive together, united. So I hope that we can find ways to cooperate in the future, because today you see it, it's crucial. Now it's not a matter of making money or being successful. It's a matter of this is actually killing people, not getting in the medical supplies that we need. And that's a direct result of this trade war. It's a direct result of politics that we have in place between the two largest superpowers in the world that can't seem to get along. I would like to see China relax its policy on exporting of medical products, and I would like to see our government relax a lot of its policies on importing and exporting of products. So the trade war, I'd like to see it get readdressed, and I hope that come the new election, it's going to be a major topic that's going to be able to, we need to come to a resolution there.
I would like to believe, just in terms of not so much the ecosystem, but more importantly, humanity, in that we understand the importance of all sticking together, coming together as one, as a people. A lot of times, now, especially with politics in the United States, there's a lot of segregation, and they do it for the reasons that they think are good, but at the same time, I think that it divides us. You hear a lot about women, and women's own identity, and you hear about cultural identity, but at the same time, for me, I just believe that if there's one thing that we can grab out of this, it's just all becoming one human race, where there's no up and down and who's got it better than the other, this and that. We all struggle, we all fight together, and hopefully at the end of this, not only a better ecosystem, but more importantly, just a better look on humanity altogether, to where we can all come together as one and stop identifying each other in one way or another as far as with gender and culture, and just come together as one human race.
Some do, like the paddleboarder and the surfer. I think they do feel they've been violated, their human rights. And I think it's just, we have to obey and the rules, all of us. And I think it's just, we're in this together, and it's a team effort, and it's not just, local, it's worldwide, and it's becoming more and more worldwide.
Well, I lived in China for 7 years, and I noticed that in China there's more of a commitment to follow the government and what the government.
More discipline.
Yes, very, to the point where when you're supposed to wear face masks, everybody will wear face masks. When you're not supposed to leave your house, everybody doesn't leave their house. And you see a country that's 5 times the size of America per capita, and this country is able to curb this within 2 months. It's because everybody's doing what they're supposed to be doing. And so I'm glad to see, the proactive steps that California as a state has taken is very impressive. And I'm very happy with Mr. Newsom and what he's done as our governor. I think that he saw this coming, he trusted the science, and he acted accordingly. And I think it could have been much worse in the state of California had he not acted so quickly and been so proactive. So I really appreciate our state government. I think they've done a wonderful job.